Immediate use steam sterilization, IUSS. So this is just going to be a review or refresher. So I do apologize if you know a lot of these steps. Hopefully I can just clear up a few things for you on the back end so that you can actually speak to the process. Um, Recommendations from the Centers for Disease Control, the Joint Commission, and AORN, also known as the Association of Operating Room Nurses. So the CDC says some unfavorable events have been associated with IUSS sterilization, including postoperative infections and clinical burns. IUSS should not be used for convenience as an alternative to purchasing sufficient instrument sets or as a time saver. It is not recommended for implantable devices. The TJC says that knowing the total IUSS rate may not be as useful as taking a more detailed look into the root cause of instruments, procedures, and surgeons frequently needing IUSS methods. The more detailed the tracking, the better we can anticipate and correct processes that reduce our need for IUSS. AORN says that the facility's instrument inventory should be sufficient to meet anticipated surgical volume and permit the time to complete all critical elements of reprocessing. Implants should not use IUSS except in a well-documented emergency situation when no other option is available. So autoclave efficacy is happening daily, and the nurses upstairs are looking in the IUSS logs to see if they can actually utilize the autoclave for that day. So each day, the Bowie-Dick test, also known as the dynamic air removal test, validates proper mechanical removal of the air in the autoclave or in the chamber. The challenge pack is testing the steam. So you always want to check your lot numbers and your expiration numbers. But the Bowie-Dick comes in the blue package. It always requires a warm-up cycle first. It's also performed with the pack right above the drain, and it should be ran before the challenge pack in its own separate cycle. Steps to the Bowie-Dick, just an example of what it looks like, the warm-up test and the actual dart test. Run the dart warm cycle. Check the expiration and lot numbers always. Document on the IUSS log. Place the pack right above the drain on the bottom shelf. Run the dart cycle. After completion of the cycle, carefully retrieve the package. Checks and documentations on the temperature sensitive paper. Parameters were met on the printout. Document the results on the IUSS log, and use your first initial and your full last name. Write legibly on the printout and on the IUSS log. Staple the result card to the IUSS log. So the Bowie-Dick results, if the test fails, try it again with a new dart pack and cycle. So here above, you'll see the unprocessed form comes bright yellow. A pass is a full or uniform black color change. If you see any hints of lightness or just where it's just not a uniform black, then that would be a fail. So you really want to make sure you're looking at these results. If you see a yellow, you want to run it again with a new pack. If it fails again, then you're going to shut that machine down for the day and call to get it serviced. Also want to alert biomed and alert your charge nurse. Don't forget to document legibly and staple it to the IUSS log. So here, the result card as well as the CI from the challenge pack are stapled on the back of it. So the challenge pack is the second test that's ran on each autoclave. And you always want to check the expiration dates and lot numbers. Remember, the lot numbers always have to match your control. And inside of the packs, it includes the chemical integrator, which says accept or reject, and then the biological indicator that has the actual spore inside of it. So that would be incubated. So the chemical integrator reacts to all of the critical parameters: time, temperature, steam for an autoclave. It should be documented and stapled to the IUSS log. And I showed you that in the picture before. The biological indicator contains the resistant bacterial spore, Geobacillus stereothermophilus. It determines if the sterilizer load was processed to a level of confidence that is safe for the patient. So the steps to the challenge pack to be completed after the separate Bowie-Dick test has been ran and documented. You want to check the expiration and lot number, of course, and it must match the control. Place it on the bottom shelf, just like you did with the Bowie-Dick. You're going to run your challenge pack on an actual cycle, pre-vac 4-to-1. And after completion of the cycle, carefully retrieve the package because it will be hot. Again, open the package, allow the biological to cool some. This is your process BI, and we'll go over the log in just a bit. You're going to crush it, document in the incubator well use and the time. And it takes 24 minutes for the incubator to read whether it is positive or negative. Check and sign that the parameters were met on the printout and the log. Initial legibly, always use your first initial and your last name, your full last name. Document and staple results of the chemical integrator CI on the IUSS log, and then document your process BI, the one that you just ran, results on the IUSS log after the incubation time, which again was 24 minutes. So the IUSS log, let's start with some of the frequent problems we've seen over time. Not getting approval for the IUSS need. Remember, this is the first step. Can we do this? Once you get this answer, you actually want to make sure you document that name on the IUSS log. Incomplete logs and results not being documented. A lot of people may have actually checked the results and know, indeed, yes, I can use this. It said it was negative, I'm straight. But they'll forget to actually put it in the documentation. Remember, that protects us. So we need to make sure that we go back in there and document it. And also, your approver is going to take some time to go back and do the same thing. All right, so breakdown of the IUSS log. So the first section is, your basic information: who approved it, what surgical service it is for, who is actually running this, operating it, and what patient this is going to happen to. So we're going to put that patient label there. The second section is going to put all of our cycle information. So the load number is documented there, and that's usually on the printout. After the actual cycle is ran, you'll see this part. So remember, always go back in and make sure all of your documentation is complete, because once your name is on that, you're responsible for making sure it's complete. So room 15 is the only autoclave that has gravity capability. But other than that, majority of them will be vacuum for pre-vac in this section. Check the appropriate exposure and dry time, which should always be the 4-to-1. All right, so the nurses upstairs are being encouraged to be as specific as possible. They're going to mark a reason why it's being performed, and if they aren't sure, they can ask their approver what they should put in this area. but you always want to make sure you delineate something on here. Never leave it blank. This information is used to trend and reduce IUSS usage. So that is always the goal here. We want to know exactly what is being done and how often it's being done so that we can go ahead and make arrangements to have more available so that we're using the IUSS less. And then at the bottom, there are some examples of more acceptable descriptions, and then examples of ones that aren't acceptable. So Kerrison Rongeur, laparoscopic liver retractor, DePuy 5 and 7 adapter, very, very specific items instead of a neuro item or just retractor or leaving it blank altogether. All right, so the fourth section is where you're going to start writing your results. Very, very important part of it. And some of the parts of this do get missed. So in this first section here, the process CI is the chemical integrator from the process challenge pack. So that is the paper form that said accept or reject. You want to make sure you put your result there. You want to make sure you put your first initial and your last name. You also want to make sure you document your control BI. So this is the ampule that did not go in the autoclave. The one that doesn't get autoclaved is going to have the live spore. And the reason we need to know, we need to always have a control that has the same lot number, because this validates if we can indeed use these instruments, because we know that our incubator can actually read a positive, so that when I get those results from that instrument or that implant that needs to be used on that patient, I'll know or have more confidence that they're going to be okay. So hence why all this documentation is very important. So the control VI, as it says, is the vial that does not get processed. It gets crushed and incubated. It should be documented as having the same lot number as the challenge pack lot number, and it should always read positive. So the processed BI, this is the part that came from out of the challenge pack that you put over the drain and actually ran. The lot number must match. Once again, I can't say it enough. After it's crushed, document the time the vial was incubated and the well number used. After 24 minutes, the incubator should display results. It'll have a plus sign for positive or a negative sign for negative. And it is essential to document the results on the log and to use your first initial and your full last name. Now, here we're looking for it to be negative. We want to know that there is no live spores in that vial, because the steam sterilization did penetrate the instrumentation, and so we feel confident that the patient will be okay. All right, so moving forward, on the right side here is where I just wanted to point out that the Bowie-Dick test results will be there. And a lot of times they'll also document the lot numbers, etc. So using the IUSS log, there's two forms that is produced from this. It's either a implant or a non-implant. So a non-implant, of course, that's just potentially an instrument that fell on the floor. Maybe it got contaminated, and this is the only instrument that we have. We have no backups, we have no peel packs, we have nothing else sterile that's going to replace this instrument. So we absolutely have to use it. And hopefully it's not a hemostat, by the way. But anyway, moving on, always make sure that the Bowie-Dick and the challenge pack has ran for the day before you use the autoclave. And a non-implant only requires the chemical integrator. We just need to know if it accepts or rejects, because this instrument or item is not going to stay inside of the patient. They are not going to leave with the patient. It's going to be put back with the tray, etc. Implants are placed inside or on the surface of the patient's body. So this, of course, is going to stay with them. A challenge pack is needed for this because, again, it has the chemical integrator and the biological indicator inside of it. Always check to see if the Bowie-Dick and the challenge pack has been ran for the day. Just another reminder, same process. So the steps before the IUSS cycle: approval from the charge nurse, clinical coordinator, manager, or STM. Instruments are always sent to SPD for proper cleaning. We do not use the sinks upstairs or any of those types of other methods. It must go down to SPD. Document on the IUSS log and use specific details about instruments and the need for IUSS. Retrieve from SPD, set up instruments in the flash pack to ensure proper transfer to the sterile field. Ensure chemical integrators are present for non-implants. We just talked about that. And then challenge packs, which include the chemical integrator and the biological indicator, should be used for all of the implants. Check the expiration always. Make sure your lot numbers match. And it should be processed with the instrumentation, but it's going to be on the outside of the actual flash pack, not inside of the flash pack. Remember, the contents that's going to be inside of the flash pack is going to be transferred to the sterile field. You need to run your test, your 24-minute test on the instrumentation before you put it on the sterile field. So a lot of the times, the surgical tech in the room or the person in the scrub roll will isolate it, put it on a prep stand that has been draped over, and sit it over there. And remember to be cautious about your gloves. You don't want to touch that without knowing for sure that it's sterile before you go back to your sterile field. So if you're unsure, change your top glove after you've isolated that item. All right, so once again, don't put it inside of the tray, preferably over the drain or on the bottom rack. It can be right inside of the autoclave, just beside the flash pack. So again, fill out the appropriate paperwork for the IUSS log, and then you can start your cycle. So after completion of the actual cycle, carefully retrieve the challenge pack and the flash pack. The implants require quarantine until the processed biological indicator is read in 24 minutes. So that quarantine is your scrub person isolating it to the side until the results are read. Open the challenge pack. Again, be cautious because it would be hot. Allow the biological to cool. Crush it and document on the time that you've crushed it and the incubator well that you put it in. Check the parameters on the printout and sign legibly. First initial, full last name. Document and staple the chemical integrator, just as seen before in the pictures, and document the process BI results after you've actually read it on the incubator. Transfer the instrumentation to the field aseptically. So a summary, things to remember: approval to use the IUSS from the STM, clinical coordinator, nurse manager, or charge nurse is always the first step. Instrumentation should always be sent to SPD for proper cleaning. The DART warm-up test should always be ran before performing a Bowie-Dick test. Always check to make sure the Bowie-Dick in the challenge pack has been ran for the day or completed for the day and that it has actually passed. Fill out the appropriate fields of the IUSS log completely. Don't forget to write the results and give detailed descriptions of instrumentation in case, of course, we need to order more of that tray. escalation. The IUSS approvers are supposed to escalate the use of IUSS to our leadership. So on the IUSS log, after you have given staff approval of the cycle, you must go and check that everything has been completed. So they are going to go back and double check to make sure everyone has actually completed these things. And we also have quality coordinators checking these monthly as well, because they do reports on these. The escalation of non-implant IUSS requires reporting to the clinical coordinator, the manager, and the SPD manager via email. Escalation of a implant IUSS requires a PSN, or a safety intelligence report, reporting to the clinical coordinator, the manager, the SPD manager, nursing director of periop, and that would be Terry for us, as well as the VP, which would be Susan Torrey. Remember, these are implantable ones. So the implantable ones do require the director and the VP. And then the premature release forms are used um, anytime the implant is taken prior to the results being read. So the approver must complete the premature release form and turn it into the quality coordinator and submit a SI, or safety intelligence report, also known as, or formerly known as, the PSN. So the premature release forms and the approver list are located in the front of the IUSS binders. And then also the approval list and the numbers to contact them, as well as a repeat of the escalation process. So now we're going to look at checking the manufacturer's IFU, because that is part of the process. So how to look up an instrument's IFU in OneSource. When you are within the SensorTrack system, you can go ahead and use the OneSource on the banner that it's pointing to, or you can go to our device and instrument page on our SharePoint. So in the search banner, you're going to put the instrument catalog number and click show documents or search documents. And then once you show the actual document, then you can actually retrieve all of the information regarding that.